Hi, this is Andrea Alamani with Patient Navigation Team. We are here again doing a podcast, Give 'em Health. So today we are going to speak with a retired nurse, and we are going to do some more barrier busting. With me today is Bob Cappel.
Hello.
Hi. Thank
Good
you
to
for
see you.
joining us today.
My pleasure.
And Bob has had a multifaceted career, but the last part of your career was as an RN in a cardiology ward, right?
Yes.
So tell us a little about your other professions and how you got to that point.
Oh goodness. My first introduction to the medical field was as a dialysis technician.
Okay.
So we would go in and initiate dialysis treatments for patients whose kidneys were failing or not working. Or from that point, I went to nursing school locally. Finished that. I'd already had a BA in economics and went to RN to BSN program, received a Bachelor of Science in Nursing, became employed at a local hospital on the heart floor.
That's great.
Something I never expected to do in my life.
Well, congratulations to you for completely jumping into a different career and also for doing that at the age of 50. That's encouraging to me.
18 years. And never say never, just keep on trying. As things change, you change. So.
That's great advice. That's great advice. So we have promised that we are going to have not only patients on our show, but also healthcare providers. I think you've already seen an insurance representative, and now we're going to talk to a nurse. What we want to do is find out from our RN that's with us today, Bob Cappel. We want to find out what it's like to be a nurse and the things that you can do as a patient to be a better patient. So I think what we would like to hear from you is your side of the story about patients coming into the hospital. What would you like for them to ask of you? What should they expect of you, and what would you like for them to do?
They come in and they check in, and we get them in the bed, get them comfortable, and then prepare them, instruct them, give them the knowledge they need to be a successful patient at the procedure, and then we take care of them until they're ready to be discharged. But patients are usually, I always said, if they don't understand what the doctor is communicating to them, maybe the language, the terminology, just ask and we'll do our best to explain what's going on and why we do things. If they bring family, we really have a small room. You have maybe one chair, one lounger. Somebody could spend the night. There's waiting rooms so that we just don't like everybody to be packed in the room with the patient. As they come in, be mindful of your children, your infants. It's very quiet in a hospital. It's very similar to church or a restaurant. Fussy children just kind of stand out and can disturb a lot of people.
Right.
Follow doctor's orders. If the doctor, after a procedure, he says, don't stand up for 6 hours. You have to lay in the bed. Keep pressure on your wrist. If your heart is accessed through the wrist.
You're talking about stents right now, which
Yes, those are stents.
So it's February. It's Heart Month, and so very appropriate topic. So you're saying that you really have to instruct them at how to keep from having bleeding issues after the stent?
And complications,
Okay.
yes, and how to take medicines. If there is a complication after they're discharged, how to deal with it, who to call, how to hold pressure. If they have a pacemaker implanted, don't fiddle with it. Leave it alone, let it heal, and take care of it as you would any surgical site.
Do you find that the patient hears better and you get better questions from them if they have another family member or someone else with them, so there's two sets of ears hearing what you have to say?
That's true. Sometimes a family member can really be tuned into the patient. I can give an example, I believe. Went into a room one morning and the gentleman said, I woke up and I was on a scaffold outside my room where they had a crane out there building, adding on above us. He said, I was sitting on that scaffold in my bed and woke up and looked down. I said, that is really interesting, of course. his wife had a book of side effects, and she said, well, this one particular medicine causes vivid dreams. I'd never heard that before, but I thanked her, and so from then on, everybody that took metoprolol or metoprolol, depending on your pronunciation, I always advised them that they could have vivid dreams for a couple days, maybe a week after they started on the new medicine.
Wow.
So you just try to tune yourself into the patient to give them the advice and the guidance that they need.
Okay. I know. I think some people, and maybe particularly older patients, may feel a little reluctant to ask questions because they don't even know where to start, and so I think sometimes that becomes an obstacle for you being able to tell them things and get them to ask questions of the nurses, right? So
that is, some people are talkative, very expressive, and some people are just turned inward. I always mentioned that if anything changes, hit the buzzer. If you start feeling bad, if you start hurting, things are changing, you can't breathe. The patients were all hooked up to monitors, so at the main desk we could see what their heart was doing and their breathing, and many times we had the oxygen sensor, so we knew how much air how well their lungs were working and taking in oxygen into their system. So just call us if you had and we'll get there as soon as we can.
You mentioned pain, and right now we have such a big issue with the opioid crisis, and I know that doctors and healthcare providers are becoming more conservative about providing those types of pain medications. So, on the other side of the coin, there's no need for someone to be in pain for the most part. So, how do you expect a patient to interact with you, and tell us how, if you're in pain and you're in the hospital bed, what's the best way to make that known, and what do you do as you're getting your medications? How do you let your nurses and doctors know how things are going for you?
Okay, well, there's generally two types of routes of administration. One is pre-scheduled. We try to duplicate what a patient takes at home.
Okay.
So if they have a particular medicine that they're supposed to take every 3 hours, it's on the schedule and we deliver it on 3-hour basis. Okay. Then there's the what's called as needed, PRN medicine. So if you're in the bed, you start having a headache, or you start having pain in the arm or legs or anything, you just hit your buzzer and call, and we do an assessment to verify that there's issues there. The medicine list that's kept by the pharmacy on the computer should have some medicines available for pain, to help with pain. Okay. If the timing is appropriate, then we'll go get the medicine and deliver it to the patient.
Well, I had some clients that said, oh, I want to just wait it out and see what the pain is like a post-surgery once they're home. And I'm like, no, you really don't want to do that initially, because what about, I'm thinking breakthrough pain, and so can you touch on that a little bit?
Yeah, pain is very interesting because if you don't deal with it when it's minute, many times it will snowball, and it'll get to a point where it's really hard to control and to moderate, reduce, and treat. Yeah, and pain can be a sign of problems. Say you have a knee replacement and it starts hurting. You don't expect it to, as a medical professional and the physicians, you don't expect it to be hurting at that point. You deal with it with some pain medicine. A nurse would call the physician and say, look, this is an issue your patient's having. You might want to come by and talk to them, and let's get down to the basis of this problem and see what's going on. Things like, say, a knee replacement, you should not generally have problems with your foot, but anything can happen. You don't know. It's a science, and everybody's different.
That's something that pain management is in a lot of hospitals in their Bill of Rights, in their patient Bill of Rights. And so we had talked about that before we started recording. And you had mentioned that you had a patient that even said they preferred one gender of nurse over the other. And how did you handle that? I know you said you were involved in that a little bit.
Well, elderly female said she preferred to have a female take care of her and help her with her daily activities and bath and things. And I said, well, that's fine. I know just the one.
Thank you for that. I think that's really freeing for people to know that they can ask about things like that make them feel more comfortable in the hospital setting, because you're already out of your element so much. And so, I think that's it
can be a frightening experience. Part of the care, the rehab, is to get up and walk, and sometimes people just don't feel like getting out of bed. Well, they try to put it off. Well, I'll can you come back in 10 minutes? Can you come back in 15? I said, no, we really need to do this now and get moving a little bit and just walk up and down the hall maybe and back to the room.
From your point of view, what are some things you would want patients to do when they come into the hospital? Especially, sometimes when there's an emergency happening, you can't think of everything when you're being put in the EMS, and carried away. But if it's something a little less emergent, what are some things you would want your patients to do when they come in?
Be prepared to talk to the physicians, and by that I mean if you have hearing aids, if you use hearing aids, bring them. Make sure you have them. If you have glasses, because the doctor wants to talk to the patient, and if Grandpa Joe can't hear, we've got issues. So.
Very good points. And a lot of times things happen in the middle of the night, so you don't have your glasses on, you don't have your hearing aids in, and so those kinds of things make it more difficult for an older patient when they're there. If they're impaired by not having those things, then they're going to more likely experience some hospital amnesia kind of things. And
you can. We don't want folks to get into difficulty. I always wanted to try to stay on top, to be aware of what's going on and be prepared. And but then sometimes you don't know what to expect. And
right. Well, nurses certainly have a tough job. So I, for one, appreciate all of your work and keeping people safe in the hospital and helping them get better.
It's enjoyable to help people get better, to be more prepared to just go out in the world and live their lives.
So one thing I've noticed when my dad was in the hospital is at that 12-hour mark where that shift is changing, my mom would get a little antsy because she knew there was a new nurse coming in, and you don't know as the patient or the family what that transition looks like for the nurse. So when you're changing shifts, what do you have to do as a nurse to make sure that other nurse is prepared?
Okay, that's excellent, because as the shift is ending, we want to make sure the medicines are passed out, the blood pressures are taken. If there's diabetic, we check the sugars. Then we'll go into report. So the new nurse comes in and looks through their information, a patient's information, and gets an idea of their patient list, and then we go in and tell them where the patient stands. If they're going for a procedure in the morning and they have to be prepped at night, sometimes there's special baths. You use betadine to bathe, especially to clean the area that the doctors may access the body. Blood pressure, history, things that have happened during the day to the patient, so that the nurse coming on duty has a heads up about what their patients are, how they are, their status, how they react to the staff in the hospital, and to be prepared is what to do.
That's a lot more than I thought. Because it looks pretty. It sounds like it's seamless, but But from the family member, you know, you just go like one nurse goes out and another one comes in, and so it's nice to hear the detail of what you do to make sure that transition is smooth for your patients.
Yeah, you want it to be as smooth as possible so that the patient can get the care they need and have the successful outcome.
Okay, I have another question too, but kind of related, because I've been in the hospital with family members, and it seems like every 2 hours the nurse comes in and like takes your temperature, and is all that really necessary? Because if, you know, to the patient laying in the bed, they're like, oh my goodness, I just want to sleep and get better. I do not, my temperature's fine, you know. So could you just shed a little light on why that has to happen?
Yeah, they look up and say, what now? You know.
That's right.
Didn't you just do this? But say the blood pressures, especially on the heart floor, are really, really important. There's usually a monitor that shows the heart rate. We could set the monitor to automatically run blood pressures every hour, every 15 minutes, depending on what's needed. A little finger sensor goes on for oxygen level. Are you having any pain? Are you bodily functions? Do you need to go to the bathroom? Do you need something to drink? You know, are you comfortable? You know, you want to assess the patient so you know how they stand. If something's different or out of line, then you report that to the physician and let them know.
So really, it's just to make sure that their medical status is not changing dramatically over the course of the night. So they're not. You're not going to stop interrupting their sleep because it's valuable information.
Yeah, that's 6. I think it was every 6 hours, 4 times a day. We do vitals.
Okay.
To get that, and there are instances where the monitor starts beeping and the heart rate was 76, and then it's 50, and then it's 40, and you're in there right away.
Wow.
Yeah, I remember sitting at a desk looking at the monitor, and they went into a deadly heart rhythm, and we looked at each other. Yep, it's real. We called a code. We shocked the heart.
Wow.
And they survived.
That's amazing. Well, thank you for that. That's so much caring that you're expressing there, and so that's what we need with our nurses, and that's what we have. So thank you for being with us, sharing that.
Get a little emotional at times about that. So.
I think it's important. I think it's important though for people to know that the nurses, they do have a job, and their job does involve, you know, taking care of you in a really bad situation and helping you to get better. But as you can see, they also really care about you, and that's why they are doing what they're doing. So, well, thank you for sharing all of that, and especially that particular story. I think that's very touching, and it's very nice to hear that is how our nurses are. And I have friends on Facebook that are nurses, and they're always posting things about how they love their patients, and that's how they bond with them, is by caring for them. So we are grateful for the nurses and doctors that we have. Yeah. So thank you. Thank you so much.
You're welcome. I enjoyed it. I enjoyed doing that job. It was just really rewarding.
So in closing, we are going to ask Bob to let us know some things to watch out for if you're having heart issues. And just so everyone understands, Bob is a retired RN from a cardiology practice in the area. So he's going to just tell us a couple of things. But if you are a cardiac patient, you really do need to go to your doctor and get specific symptom information from them. This is not a substitute for that. This is just, we're just helping you with some pointers here. So thank you.
And yeah, a lot of the symptoms are online. A Google search will bring a lot of things to you, but what what amazed me about some of the patients that would come in are, well, I was raking leaves, I was shoveling snow, I had a little twinge, it went away. The next day I had another little twinge, I got short of breath easily. I'd do a little work and I just couldn't breathe, couldn't catch my breath, couldn't climb steps like I used to. My jaw might hurt. I might start having pain, especially in the right arm. One gentleman told me the tip of his finger felt bad and hurt, and he was into the hospital and had a stent because he had a blockage. Females usually have a little different signs and symptoms. They're not the traditional, oh my God, there's a fist in my chest.
Right.
But, and so many different parts of the body can cause odd pains. You got the liver, you got the stomach, you got the gallbladder, you have the appendix. A lot of things can cause pain, and if it doesn't go away, or if it starts getting worse, just let your doctor check it out.
Okay, very
Sure.
good advice.
Sure.
From someone who has seen a lot. So,
That is right. That is right.
thank you so much.
Okay.
Well, this concludes our podcast with Bob Cappel, and so we are so appreciative that our retired nurse friend was able to stop in and tell us some stories and some advice for us as we become patients. Hopefully, not that often, but thank you so much
Okay.
for your care as a nurse and for joining us today.
You're welcome.
Thank you so much, Bob.
You're welcome.
Yes, so if you would like to get in touch with me at any time, you can reach me at my website. It's patientnavteam.com, and my email address is andrea@patientnavteam.com.